Welcome to this overview of the Comprehensive Class Member Transition Program Service Plan tool provided by the UIC College of Nursing. This presentation is designed to provide care management staff and their supervisors the information needed to complete the Comprehensive Program Service Plan effectively, and to synthesize the information provided in the assessment completed by Maximus and internal agency assessments to develop service planning goals. The information provided in this training module is outlined in policies P3.01, Comprehensive Service Plan Development and Transition Planning, P3.06, Service Plan Quality Reviews, and policy P6.03, Serving Members with No Income, which is described in more detail in Orientation Module T3.3, SOAR, and Orientation Module T6.1, Special Processes. Please note that this training module presents an overview of the information provided in more detail in these policies. CCMTP program staff should read and understand each policy in detail. Policy P3.01. Comprehensive Service Plan Development and Transition Planning. Service plans must be completed in full in the web app for all class members who are active in the CCMTP and have had a completed Maximus Transitional Assessment. The first service plan is to be completed and finalized within 45 days of receiving the referral from Maximus. This plan is referred to as the initial plan. Please note that an initial no-income CSP type was added in FY26 and should be used only when class members are unable to obtain income. We will discuss key components of that CSP type later in this module. Generally, initial plans must include goals and interventions relative to class members' time in the nursing facility or SMRF, for example, education and skill building. The CCMTP defines set periods for when service plans are required to be updated. All community moves must have an updated service plan finalized within 30 to 60 days preceding the transition date to the community, referred to as the transition plan. Transition plans must include goals and interventions relative to class members' community needs, for example, obtaining durable medical equipment, homemaker services, appointments with specialists, monitoring health and behavioral status, and collaborating with providers. All class members who reach 17 months in the community must have a service plan completed within the 30 days preceding the 18-month milestone. This is referred to as the termination plan. Throughout the transition continuum, all class members must have a service plan no older than 180 days old. Therefore, a new service plan must be reviewed, updated, and finalized every 180 days, or as clinically indicated, throughout the pre- and post-transition activity periods. Examples of when a service plan is clinically indicated to be updated sooner than 180 days may include, but is not limited to, when a class member enters a respite stay, and when a class member's physical or mental health significantly changes. Under the CCMTP model, the care manager is responsible for service plans, as well as pre- and post-transition care management. The service plan should incorporate the findings of the assessment completed by Maximus and any additional internal agency assessments completed, for example, nursing and occupational therapy assessments. Service plans are completed in the web app with active participation and insight provided by the class member and legal guardian when applicable. Additional participants may include nursing facility staff, family and social supports, prime agency staff, and providers. Information from other sources such as agency assessments, nursing and occupational therapy assessments, UIC ATU documentation, and facility provider documentation is encouraged to ensure the service plan developed provides a comprehensive summary of preferences and needs. All sections of the service plan are to be completed before finalizing the plan. These sections include service plan details, which is an overview of the service plan and class member details. Background and demographics, which reflects current insurance, advanced directives, income, and criminal legal involvement. Housing preference, which reflects the class member's preferred housing type and location. Condition status, which provides an update on the class member's diagnoses, medication, and functional status. Employment and income support, which describes the class member's previous experience, current status, and future goals related to education and employment. Medical equipment and supplies, which describes the class member's durable medical equipment and supply needs and their status. Transition services, which indicate clinical and non-clinical supports and services and documents their current status. Individualized plan, which documents the individualized plan, including goals and interventions to address the class member's needs and preferences. Community provider list, which is a list of current known providers. And finally, plan development, which documents the participants involved in the development of the service plan. For example, CCMTP staff, facility staff, providers, CMHC staff, informal supports, and of course the class member. To view and add a service plan in the web app, click on Service Plan under Assessment on the sidebar on the class member details page of the class member that you are working with. This will open a screen with a list of all available service plans. You may view or download established service plans by clicking on Details or Download, respectively. To add a new service plan, enter the planner and plan date and click Add. This will add a new plan. Then click Details to view and edit the details of the plan. Once the plan has been added, review the details in the Service Plan Detail section. Ensure the planner and plan date are correct. If this plan was updated due to a quality review, click the corresponding checkbox. Also indicate what type of plan it is using the drop-down, for example, initial or transition. This page is also where you will indicate if the plan is an initial plan for a class member with no income. Click Next to save and move to the next section. The next section of the service plan is Background and Demographics. Review and update any indicated details regarding payer. If there has been a change, click the Check to apply the changes above on members level as well to reflect the update on the member page. Review and update advanced directives and income, completing the fields as indicated. Finally, review and update information related to legal involvement. Next, you will review housing preferences. This includes information about the projected transition date and the housing locator working with the class member. Planned housing type and reasoning for non-PSH options will also be documented here. This is important to establish how consent decree standards are being addressed. Select the class member's preferred geographical location from the housing location table. Check all that apply. Next, review condition status. Review and update the documented details to provide an update on the class member's health status. This includes diagnoses and related status or symptoms, vital signs, medications, and functional status. If no details have changed, record a note in the comments to document that the section has been reviewed and verified and the date this was completed. The information documented in this section is used for many CCMTP processes, including quality and clinical reviews, as well as reporting of class member characteristics. The Employment and Income Support section reviews the class member's education, employment, and income history, as well as current needs and future considerations. As noted earlier, there are special procedures for service planning with class members without income, outlined in Policy P3.01, Comprehensive Service Plan Development and Transition Planning. The primary goal for class members that are referred to the CCMTP without a source of income must be to obtain income. Therefore, a special CSP type, initial CSP no income, should be selected for these class members. Initial CSPs for class members without income are not required to address all needs and services in a typical initial CSP. Initial CSPs for class members without income must focus instead on services to obtain income, for example, SOAR services, employment, other income sources that may be available to the class member. Other goals include obtaining essential documents to work or participate in SOAR, and linkage to specialists and specialty providers to support disability documentation. The class member may request to work on additional goals simultaneously. Those goals should also be added to the initial no-income CSP as requested. Once a class member obtains income, the CSP must be updated within 30 days to address all transition needs. As a reminder, to indicate that a CSP is for a class member without income, care managers should select Yes in the No Income Service Plan section on the Service Plan Details page. Medical equipment and supplies is used to document the needed equipment and supplies as well as the current status. For example, if a class member uses a walker owned by the facility, this would be entered and indicated as needs and does not have, with an added comment that the class member is using a facility-owned walker and will need their own before community move. Another example might be that a class member has an automated blood pressure cuff, but does not know how to use it. This could be reflected as a has and does not meet needs status with the appropriate comments. Any gaps in medical equipment and supplies should be addressed within the individualized plan. Transition Services provides a space for care managers to document the needed supports and services as well as the current status at the time of planning in a checklist manner. Services and supports are sorted by domain, such as mental health services or specialty clinics. If the class member has or needs a service, click the corresponding box to the left of that service. Then select the status from planned, current, declined, or unavailable. Planned indicates the class member has a need for this service, but it has not started. Current indicates they are currently receiving this service. Declined indicates the class member has an identified need for this service, but the class member declined linkage. Finally, unavailable means the service is an identified need, but the service is not available for reasons such as location or lack of approval by insurance. There is an option to write in services within domains as well. This area also identifies the status of Medicaid waivers. Please note that supported living programs are listed as a Medicaid waiver. If the class member is moving to this setting, the approval status should be documented here. The Individualized Plan section is where the care manager will document the member-specific goals and the plan to address them. After gathering all needed information, the care manager should then categorize the identified needs or preferences into one of the 7 service plan domains or sections. They are physical health, mental health, substance use, functional status, medication, housing, and community integration. We will discuss them more in detail now. Physical health includes any physical health components, including overall wellness plan, management plans for specific conditions such as blood pressure monitoring for hypertension, and needs related to specific providers, such as a dialysis center, diabetic educator, or cardiologist. Behavioral health needs are split into mental health and substance use due to the context and impact of the conditions within the population. Mental health components include components related to mental wellness, as well as needs related to mental health conditions such as depression, or risk factors such as history of suicidal ideation. Similarly, components addressed within the substance use domain address risks related to substance use. Functional status components include functional needs to transition to and maintain functioning in the community. This should include both formal and informal supports needed for ADLs and IADLs and other functional needs. Medication management is addressed in the medication section due to the associated risks. When reflecting on functional needs and related plans, it is often helpful to consider the steps related for each task. For example, paying bills not only requires an income and the physical payment, but it also involves budgeting, retrieving mail or electronic records, and skills related to payment. Similarly, medication management requires multiple steps, such as understanding provider instructions, filling the prescription, opening bottles, ingesting the medication as prescribed, and monitoring for side effects, to name a few. Plans related to functional status and medication should reflect the areas needing to be addressed. Housing-related components, including finding and maintaining housing and needed adaptations, are addressed in this domain. This may also include items such as planning for utilities and furnishings. If there are identified barriers to housing, they should be addressed in this section. The last domain is community integration, which includes other components related to full community assimilation. This may include items such as community resources and supports, food supplies, social supports, education, employment, or hobbies. Care managers should establish SMART goals within each domain. SMART is an acronym to help service planners develop member-centered goals in a format that makes it likely for them to be successful. SMART goals are specific or short. They address a single need or challenge. They are measurable. They have a quantifiable outcome. They are attainable. They are goals that the member has the ability to meet. They are realistic and relevant. They are related to the need they are associated with and are likely to improve it. Finally, they are time sensitive. There is a timeline for completing the goal. Let's look at an example. Consider a member who has multiple high-risk medical diagnoses, including hypertension, diabetes, active wounds, and renal disease. And the member has limited experience with self-management. In what service plan domain would this challenge best fit? This need, increasing self-management of health conditions, would be classified under the physical health domain or section of the service plan. An example goal for this member might be that the class member will be able to demonstrate the ability to independently check their blood sugars 4 times a week by the end of March. That example meets the criteria for a SMART goal. It is short or specific, as it focuses on a single diabetes management task. It is measurable, since the 4 times a week element is quantifiable. It is attainable. It's both a necessary task to manage diabetes, and there are no obvious barriers for the class member. It is realistic and relevant, since it directly relates to diabetes management. Finally, it is time sensitive, since it has a clear end date that is manageable. It is important to remember that goals should have clear outcomes that are related to the identified need or challenge. They should not be outputs, that is, simple actions that the class member takes, or general statements about the class member. While saying that the class member should go to the doctor may make sense as a recommended activity, it's not a goal related to the identified need. The statement doesn't help the class member make any specific behavioral change or improvement in their health status. Going to the doctor in and of itself is not going to improve someone's health. What do you want the class member to do with the doctor, and how will this relate to the identified need? Finally, you can build interventions to address the identified goals. Interventions should be based on action verbs, things like link, collaborate, monitor, refer, coach, educate, advocate, or support. They must relate specifically to the identified goal, and whenever possible, include the member's identified strengths. They should also reflect the member's cultural context, that is, their background and experiences, and be considerate of the member's abilities, both functionally and cognitively. Given the example goal we have been discussing, interventions that would make sense on the service plan include linking the member to a diabetic educator, collaborating with the facility to ensure the member has appropriate testing supplies, and monitoring the member's blood sugar logs on a weekly basis. While these interventions are all structured as provider-staff accountabilities, interventions can also be written for actions that the facility or other providers must take, or that the member will be responsible for themselves. To document your SMART goals and interventions, you will enter them into the individualized plan section of the service plan. In the first column, identify the section or domain. In the second column, write the SMART goal to address the identified need. In the next column, spell out the specific interventions or strategies to be used to help the class member meet this goal. You must also indicate which party or parties are responsible for implementing the intervention. This could be the prime agency, the nursing facility, the class member, or one of the other involved parties. There is a text field where you can be more specific about the provider responsible. Indicate the status for addressing this goal. Mark pending if a goal is planned, but pending. For example, a goal to apply for SSDI and the application is pending. Mark ongoing if a goal is ongoing. For example, a goal to check glucose levels daily. Mark completed if a goal can be completed and is completed. For example, the application for SSDI has been approved. Mark not completed if a goal is not complete. For example, a goal to volunteer, but the class member determines after transition that they do not want to volunteer. The status of each goal should be updated with each revision of the document. Enter a start date and estimate a completion date. Although this is not a hard commitment, the date should be edited as the projection is revised and the service plan updated. Finally, ensure to click the Add button to save the addition. Repeat this process for each goal. After completing the individualized plan section of the service plan in the web app, you will move on to the Community Provider List section. In this section, the care manager should document the current providers the class member is seeing. This includes their PCP, any specialists, like a cardiologist or neurologist, or specialty clinics where they receive care, such as a wound or dialysis clinic. Providers' contact information should be recorded whenever possible. This is a good opportunity for the care manager to review if a release of information is needed for advocacy and collaboration with the provider. The Service Plan Development tab documents the individuals who participated in the development of the service plan. This should include, at minimum, the class member, care manager, and legal guardian when applicable. This may also include a supervisor, family or other supports, or a facility representative. Before finalizing the plan, review all available information to ensure the service plan is complete. After reviewing the full plan, finalize the service plan by clicking the box next to Finalize Service Plan in the last section, Plan Development. Ensure Save and Next is clicked to save the finalized status. The date this is saved is recorded and used for reporting. The service plans within the web app are designed to pull information from the most recent service plan into the next plan. If additional information becomes available after the plan is finalized, or if there is a significant change in status, add another plan and provide the identified updates. As a reminder, the 24-hour backup plan should be completed before the community move and updated as needed both pre- and post-transition. The class member and representative, if applicable, should be given a copy of each CSP once they are completed or anytime updates occur. Service Plan Quality Review, Policy P3.06. The CCMTP requires a quality review of identified class member CSPs by UIC-CON. The purpose of the CSP quality review is to ensure that class members have a person-centered CSP that addresses their unique needs, interests, goals, and preferences to support their community integration. After the Prime agency completes the CSP tool in the web app, UIC-CON will review a sample of initial CSPs, all transition CSPs, and a sample of termination CSPs. The CSP must have all domains completed in full in the web app as identified in Policy P3.01, Comprehensive Service Plan Development and Transition Planning. If an area within the CSP does not apply to the class member or information is unavailable, the Prime agency must address within the plan why that domain was not completed. Note the exception for class members with no income, discussed earlier in this module. A CSP is deemed proficient as evidenced by all required documentation is available for UIC-CON to review. The initial CSP includes clearly documented goals and interventions relative to class members' time in the skilled nursing facility or SMRF as they prepare for transition to the community. The transition CSP and termination CSP includes clearly documented goals and interventions relative to class members' community needs in their new setting. High-risk needs are identified. There is a linkage between risks identified and documented goals and care management interventions. The CSP is person-centered and integrates the class member's strengths, preferences, vision, and goals. There is evidence that the CSP was developed using multiple sources. There is a demonstration of shared accountability for CSP implementation. The CSP includes a projected transition date. And when the class member is not recommended to transition to permanent supportive housing, their CSP identifies the reason as well as goals and interventions to work towards transition to PSH. A full list of requirements for a CSP to be deemed proficient are outlined in Policy P3.06, Service Plan Quality Review. Current versions of all comprehensive program policies and forms can be found in the web app library, and educational resources can be found on the Colbert-Williams training website, managed by the UIC College of Nursing. Any questions can be directed to the Colbert-Williams Help Desk, linked at the bottom of every page of the Colbert-Williams training website. Thank you for your attention and efforts to ensure safe and successful class member transitions.